what we're looking at is healthcare improvements to our entire system, and we think that it's possible that we can help improve healthcare in Greater Sudbury, and we can do it very soon because of a very unique situation that we have here in the Sudbury area, and it's one that, John, you and I have investigated to some extent over the past little while, and we feel that it needs to be drawn to the attention of the public, just how we can get better health care in our region. We can look after our older citizens, those who are ALC patients, alternate level of care patients, but also those people who are not older senior citizens, indeed everyone of any age who makes use of our health care facilities, and in particular our brand new hospital.
Yes, definitely.
Now, we want to start by saying that we are very much in favor of maintaining the Memorial Transitional Care Site, which is apparently scheduled to close according to directives given by the local health network, the LHINs, which is a short form for Local Health Integration Network, which makes all decisions with respect to healthcare. But we are making the recommendation that the memorial site, which currently has 130 patients, many of whom will be moved out to other nursing home facilities in the area, but still at the regional hospital site there remains anywhere between 50 and 60 alternate level of care patients. And we'll be going into some detail just explaining why this is a problem, but it's also an opportunity if the memorial site stays open.
So I think that this issue goes beyond a seniors issue. This is a issue of citizenship. We have to look after each other so that in our declining years we can decline with some degree of dignity. And I don't see that happening for some people around here.
I think that this is an issue that one of our physicians here in the city mentioned to me just the other day, that he's concerned that possibly our older folks are not going to get the care that they really deserve, and the resources are going to be put in other areas of the healthcare system. And maybe we can see this. I know that when we visited the regional site, now that's the old Laurentian hospital, it's now called the regional hospital, which indeed does serve the entire region. This is another issue that is of very much concern, because it's not only Greater Sudbury, but our hospital does serve the entire region of northeastern Ontario. But when we visited the regional site, John, we noticed that we had up there approximately anywhere between 50 and 60 of these alternate level of care individuals who were in that hospital setting and not really receiving the care that they would receive in a nursing home, or not even at the transitional care unit.
Well, because the mandate of the hospital, the regional hospital, is to be an acute care facility, and there's also a push to make it a teaching and a research hospital. So it's got mandates that don't really include dealing with alternate level care patients, but they have them on site and they're doing their best to cope with the fact they're there. There's no doubt, having observed both sites, that if I had an aged parent that I couldn't get into a nursing home, I'd much rather have them in Memorial than at the regional hospital, and that is not to slight in any way what they're attempting to do at the regional, but the regional hospital is there for other purposes. It's not there for people who need alternate levels of care.
And of course we know at the regional hospital, and we've had many stories, we know that individuals, including myself at one time, were in the emergency department having to stay overnight in sometimes almost in a closet or in an inappropriate area or in the hallway because of the fact these alternate level of care individuals are taking up beds at the Sudbury Regional site. Now, once the 130 people, if it is possible to indeed move all the 130 individuals who are at the transitional care site at Memorial into a regular nursing home setting, it leaves open the opportunity. This is the interesting situation we have here in Sudbury, is the fact that we do have this facility. It's been retrofitted for transitional care at considerable cost. The facility is there. We believe that it would make just good common sense to move out the alternate level of care individuals who are at the regional site over into the memorial transitional site, thereby freeing up those acute care beds and also giving these individuals better care at the memorial site. Because what we saw, John, was really these individuals were receiving really very, very close to regular nursing care in this facility.
And those people that are there are very lucky to have that staff. They're professional, they're highly trained, more so than they would be in a nursing home. These are nurses and highly trained individuals for other functions as well. And they've come together as a team in a very short period of time. And they're providing excellent care for these people. And in fact, one patient said she does not want to leave the memorial site. She considers it to be her home. So to me, that's a testament into what a wonderful job those people have done in a short period of time to make the memorial move from a hospital setting into an alternative level of care. And like I said before, I think that I would be comfortable with my parent waiting in that facility for a spot in a nursing home.
It's interesting, we've mentioned this to many individuals, and they say, well, the memorial is going to be closed. The actual building, that is. No, that is not the case. The hospital has plans for a memorial. Indeed, one floor is being used for administrative purposes. There's also some clinical functions, and indeed, there's going to be more functions moved into that memorial site. So the building is going to stay there. It's going to be maintained by the hospital, and we feel that at least one or two floors could be used for alternate level of care patients on into the future, at least until the date of 2013, which I believe the hospital itself had desired. However, the LHINs, the Local Health Integration Network, the bureaucracy, if you will, has declared that there's no problem, that once the patients in there now are moved out into regular nursing homes, then it's going to be that particular aspect of the facility will be closed down. Now, we think this is very short-sighted, and really it's discriminatory against those ALC patients, the alternate level of care patients who are currently at the regional, the Laurentian site, because they are being discriminated against. John, I think you agree that they're being denied the opportunity of being moved over to the memorial site where they'd receive better care. Now, not only at the memorial site is interesting. I know we saw recreational facilities. They also have physiotherapy.
Yes.
And rooms have been renovated to allow for families as well.
Yep.
And really, it did certainly impress us the level at which the building had been renovated. And John, as you mentioned, the staff were very dedicated and very enthusiastic about the care that was being given as well.
Yes.
Now the question really is, why does the LHINs not want to consider this particular opportunity? Because I mentioned before, we do consider it to be an opportunity that is perhaps rather unique to the Sudbury area. And Sudbury, is rather unique in other ways. We know that our emergency department is ranked in terms of actual service as one of the lowest performing in all of Ontario.
Yeah.
And a lot of the reason is because of the fact that the alternate level of care individuals who are at the Laurentian, the regional site, are really clogging up the system. They're taking up beds, and if you go on the website of the hospital, you'll find a daily indication of how many alternate level of care patients are in the facility, how many medical procedures are not being performed because of these people in the system taking up these beds, and how many people are waiting for beds. And on the average, you'll find that there's approximately 50 to 60 ALC patients in the facility. There's anywhere from 20 to 30 people waiting for beds, and on any given day, depending on the day, there's a number of actual medical procedures that are not being performed. And not only being not performed for people from Sudbury, but also from all over northeastern Ontario who are sent here because of the special facilities we have.
Right.
Now, why are we involved, and indeed who are we? If you've just joined us, my name is John Lindsay. I'm president of Friendly to Seniors, and John Gall is with me. He's the treasurer of our organization. And our mandate of Friendly to Seniors is really to represent the older adult, the senior population in the Sudbury area, and to address concerns as we see them that need to be given attention and perhaps some corrective action. And this is indeed the one area, the healthcare area, that impacts seniors to a great degree. And not only seniors, as we mentioned earlier, it's not just the seniors that are being affected by the current situation at our hospitals, but it's also everyone else, from the little boy or girl that falls down, needs to be taken to the emergency department, or has or the teenager with acute appendicitis, or someone with a gallbladder, or whatever the medical condition might be. They end up in the emergency department, and they could be there for a long time. And if they have something serious and they need to be admitted, in many cases they can't be admitted because there's no beds for them, and the beds are being taken up by the alternate level of care. Now, what have we done locally? And some people say, well, it's a provincial responsibility. It's true that there are federal funds, but also there's been a lot of local money put into this hospital. We have donated on an individual basis. The municipality has donated, and regardless of whether it's federal or provincial or local, it all comes out of the same taxpayer's pocket, our pocket. So we've all put money into this, and we all have a responsibility. What have we done on the local level? Our Mayor and Councillors Committee on Seniors Issues has made a motion to go before City Council that, and I'll just read the final part of the motion, that the Council of the City of Greater Sudbury enforce recommendations with provincial healthcare authorities involved, that the memorial site remain open and accept all ALC patients currently at the Sudbury Regional Hospital site until such time as permanent and sustainable alternative accommodations are made available, or all community-based programming is designed and in place for addressing future ALC issues. So spread the word around, and more information you'll find on our website, and it's simply Friendly to Seniors. That's www.friendlytoseniors.ca, and you'll find copies of articles, other information, links to other websites. As we mentioned before, at the Sudbury Regional site, you'll also find information on the ALC situation. So really, John, there's no shortage of information. It's just some people may wonder, why have we been kept in the dark for so long?
Well, most people don't react until they're personally faced by a crisis. And that reality is the reason why we have government. Government is supposed to take the short, medium, and long-term view of everything. They should have years ago realized that we're going to have a baby boom generation that's aging. Well, it's here now, and we're at the capacity in the healthcare system for the demand that we have now, and the demand is going to increase.
But it's not too late. And we're one of the reasons that we're bringing this issue to the public's attention is because we feel that things can be done, and we're going to continue working on it on your behalf, and we invite your participation as well. You can get in touch with us, as I say, through our website, friendlytoseniors.ca. We want to thank you very much for being with us.
Thank you.